Okay, so I'm about to start. So I'm going to introduce myself. My name is David Kadashko. I'm the medical director at BIOFLEX Laser Therapy. We're based out of Toronto, Ontario, Canada, and we're a medical device company, ISO certified, and we manufacture both consumer devices, consumer light devices, and as well as professional therapy equipment as well. My background actually I was a molecular biologist, and then I became a chiropractor and acupuncturist. And the last 10 or so years, I've been serving as a medical director here at BIOFLEX. So I do appreciate you letting me know where you're from. Some really quite interesting professionals and regular non-professional healthcare professionals listening in. Of course, I do two different types of webinars. I do one a month on using the consumer device, which is our BIOFLEX Personal Therapy System device. Many of you would have that and are not healthcare professionals. However, sometimes they're used or prescribed by our healthcare professionals. So sometimes they're listening in as well. Obviously, today's topic is very interesting. And the reason why I chose it, well, number one, obviously it's a source of temporary disability for a large percentage of women. The other thing is that the traditional ways of dealing with it, as far as medication goes or hormone replacement or whatever, birth control pill, NSAIDs, there are side effects with those treatments, and there may be other options that are perhaps safer and maybe as effective. And I'm going to talk a bit about the research as well. I do want to give a shout out to Dr. Cindy Tuten. I'm not sure if I'm pronouncing your surname correctly or not, but I know you have some personal interest in the topic today, but also on COVID, long COVID, and that kind of thing. And that is actually, and now we're starting to see some good publications in that discipline using photobiomodulation therapy for that, Cindy. So maybe if you want to reach out to me, my email is at the very end of today's webinar, and I can send you more information on that and some case studies and so forth. Perhaps that might be of interest to you as well. Again, I apologize today. My chat box is not working. No idea why. So I can't undisable it. So it's disabled. So I encourage questions. Please ask me questions along the way. I will get to those questions at the very end of today's webinar. Today's webinar and all my webinars are recorded, and then they're edited, and then they're uploaded onto our website. If you look for BioCare Plus, and then if you go to BioCare Plus, and then you'll see another button, I can't remember which one it is, then customer support, and then you'll find an icon for webinars, professional and personal therapy, and you can find all the webinars there just in case, but you need to sign up for them in order to get an email with the recorded version. Otherwise, you have to wait until they're put up on our website. So once again, thank you so much for joining me today. And obviously, I'm going to be talking a little bit about what's referred to medically as dysmenorrhea, talk a little bit about that. I'm sure everyone's kind of aware of what it is, but I'll just go over some stats and some perhaps interesting bits of information you may or may not know. And then why you might want to look at using light therapy, specifically, obviously, BIOFLEX light therapy to help manage the symptoms. And I'll talk about a bit of the research. I'm going to present one paper, or maybe two, I can't remember, but there are several out there. And then I'll talk specifically about how you use the personal therapy system that you may have or may not have for helping with these symptoms. And then I'll just comment on some other natural treatments that I researched, and then we'll go into Q&A. So our devices, for anyone that is not familiar with them, they're called the BIOFLEX Personal Therapy System 120, 180. That just references the number of what are referred to as bicolor diodes. These are LEDs, a very specific narrow band width. So they're not your standard LED, and they have two wavelengths in one diode, which is very unique. The references here to the size really is both, it can treat more surface area when you have a P180, obviously, which would mean a better result if you just do one placement of each, for example. But also it's slightly more powerful as well, which means greater energy density at a deeper level as well. So that's really, those are the main differences between the two. There's a controller, obviously. So when you look at the pad, the light pad, you'll see all the diodes. There's little bulbs that stick out. They're like sort of magnifiers, and they make contact with the skin, so the light can directly go into your tissue. That's one really important thing I recommend with using light therapy. Although, Juve and all the rest of them that just love to jump on the bandwagon. By the way, we've been around for 30 years. Light therapy used from diodes that are a distance away from the skin are not nearly as effective. And it's just physics, right? I mean, up to 85% of light will bounce off your skin when you hold something away from your skin. So when you look at the research, the double-blinded clinical trials, of which there's 1,500 or so, they all reference, or like 99.9% of them would reference touching the skin to allow the light or photons of energy to penetrate through the epidermis, dermis, hypodermis, and into your tissue where you want the light to go, not reflecting off the skin. So if you're thinking about getting a Juve or some other kind of device where you hold it away in an LED panel, they look cool, you glow red, that's all wonderful and good, but there's basically no direct research on that as far as randomized control trials go, and all the references talk about touching the skin. Okay, that's it for my rant. Our controllers look something like this. They're preset with a whole bunch of different anatomical regions with 4 levels of intensity. And the idea here is that treating your face, treating your knee, treating your shoulder, treating your hip, treating your foot, the tissues and the depth of the tissues, type of tissues all differ. So therefore the dosaging and the parameters will differ, because you're not going to treat your knee the same as you would your elbow. Because they're different sizes and structures and so forth. So hence, we have developed proprietary protocols, I guess over 3 decades of doing photobiomodulation, and we know that they're quite effective. The controller itself is very easy to use. There's a power button on off, a stop button. You can see there's a pause as well if you need to pause it to let your crazy cat outside, or select the stage of stimulation, which is both the amount of energy coming out and the pulsations of light, which are very different. And I won't go into that today. All right, so let's get right into dysmenorrhea. So a little quote from research you can see at the bottom here is approximately 15% of female adolescents report experiencing primary dysmenorrhea. I'll talk about primary and secondary in a sec. So severe that it prevents them from taking part in normal social activities for several days during each menstrual cycle. So, it's debilitating. And if there's a safe and effective way of helping young adolescent females get through that, and maybe get back to their activities sooner, and go to school or whatever it is, and more comfortable means, then that's a good thing. Dysmenorrhea, again, this is painful cramps that occur with menstruation. Obviously, it's a very common gynecological problem. Women of all ages, all races, all women will experience it to some degree, and it's obviously one of the most common causes of pelvic pain. According to the research that I dug up, was the prevalence. It can vary widely. It's sometimes underreported, oftentimes underreported, as most female issues are, unfortunately, and it can range anywhere from the low teens all the way up to high 80 or even 90% have been recorded. So as I'm sure we can all understand, symptoms are going to begin with menses in adolescence, and they may lead to obviously absenteeism in work and school, and other limitations as one would expect in social, sports activities, and academics and so forth. So of all the menstrual-related symptoms, lower abdominal back pain tend to be the ones that are most commonly associated with the absenteeism scenario, but there can be other symptoms as well, and I'll mention those shortly. The stats I saw, interestingly enough, was that in the United States, because usually this is where you tend to see a lot of data, is an estimated 600 million hours or worth $2 billion annually is lost due to missed work or reduced functional abilities due to menstrual pain and associated symptomology. So, whether you're self-employed, an entrepreneur, or you work, as an employee, productivity can be reduced, obviously. So there's two types of dysmenorrhea here, and I'm going to really focus on what's called primary, and there's also a secondary dysmenorrhea as well. So it really depends on if the underlying etiology is identified or not. Primary dysmenorrhea, or PD, is pain with menses, so the typical monthly menses. Obviously, there's no abnormality. This is a normal condition, and accounts for the majority of painful menses in ovulatory women. There can be other systemic symptoms. It's related to biochemicals released during the shedding of the uterus lining, a lot to do with prostaglandins, which I'll talk a little bit about. I mean, this is not a scientific lecture, but it's interesting. And this can lead to increased sweating and headaches and nausea, vomiting, and even diarrhea. So there potentially can be lots of other symptoms, systemic symptoms, which is kind of why it's interesting that light therapy might be also very helpful, because there's a systemic component to photobiomodulation therapy that's now starting to see a lot of research. And typical manufactured devices tend to focus on a direct response, that is light being absorbed by the target, problem area. But if you use the equipment properly in a different way, you can actually help systemically. And I've done lectures on this before. If you're interested in more of that, I can share papers and show you some webinars on that as well too. So secondary dysmenorrhea is associated more with specific pathological conditions like endometriosis and PID, or pelvic inflammatory disease, interstitial cystitis, myomas, conditions like that. So one has to be very careful about what it is you're actually dealing with, and of course, see your specialist or your family doctor just to ensure that it's not something more serious or something that maybe you need to look at treating in alternative ways. So today I'm going to refocus more on primary dysmenorrhea and basically how to use natural approaches, including light therapy, to help. We all know that oral contraceptive pills are often used in adolescent females to help reduce the symptoms of dysmenorrhea. And they are effective, but there's a large portion of women, adolescents, that it's not effective for, but there are risks. And I think everyone may be aware of them, but maybe you're not. So I do have a reference here as well. But if you look at the long-term use of oral contraceptive pills, this can increase the risk of 3 to 6-fold of venous thromboembolism, which can lead to stroke, especially with a history of migraine. That's 2 to 6-fold increase of risk for a stroke, and even cervical cancer. They feel there's causation there as well, or a link to that after prolonged up to over 5 years of use of oral contraceptives as well. The reference was from the American Family Physician Academy. You can see the reference there is 2006. So that's a link right there. So I mentioned earlier about prostaglandins. Now, remember, primary dysmenorrhea is natural uterine contractions. And what happens is there's a high prostaglandin concentration. This is a result of tissue damage and the shedding and the lining of the uterus. So it's a response essentially to what's going on, a normal response. Now, prostaglandins, there's many different types. There's one in particular called PGE2. Now, these will directly cause inflammation and pain as part of the healing process. And that's the problem. You get this high spike of prostaglandins and even some other natural biochemicals dealing with tissue damage. And of course, this will cause the symptoms. Now, if you look at light therapy or photobiomodulation therapy and our equipment specifically. When you first turn on the equipment for whatever area that you're treating, red light will be emitted. And this red light is in a very specific bandwidth of around 660 nanometers. And that's very important because red light, although it's not absorbed deeply into the body, mainly because it's partly absorbed by hemoglobin and melanin and some other photoacceptors, it does still do a good job of getting into the tissue, maybe 5 millimeters to a centimeter, which doesn't sound like that's very deep, and it's not. You're not going to reach the uterus with that. But all the light concentrates in heavily circulated area. In other words, there's lots of blood in and around that area, as well as nociceptors or pain receptors. So the red light is quite effective for dealing with superficial issues, but also inducing a systemic effect because of all that blood that's flowing around. And within that blood are white blood cells, and it's white blood cells that tend to release prostaglandins. All cells can release prostaglandins, but the white blood cells are triggered to do that when there's an injury or issue that they're dealing with. So when they absorb light, red light especially, it modulates, we call it immunomodulation, and these white blood cells are kind of not tricked, but they're switched over to reduction of prostaglandins and help control prostaglandins as those white blood cells are circulated around, which can go deeper, say, into the uterus. After the red light will be on 5, 6, 7, 8 minutes. It all depends. Then the diodes will then emit near infrared. And infrared is a really long bandwidth from around 700 nanometers or so all the way up to thousands and thousands of nanometers. So there's near, mid, and far infrared. And oftentimes I get asked about the difference between infrared saunas and this kind of therapy. Very different. Because far infrared, which is what's used in infrared saunas, they're targeting water molecules because water molecules absorb higher wavelengths and it heats them up. There's also such a thing as near infrared saunas as well that try and mimic what photobiomodulation is doing. But to be honest, and they use tons of energy. And the problem with that is that, number one, they're trying to circumnavigate the fact that they're not touching the skin because they'll probably heat up as well when they're emitting from these sort of banks of light. You've probably seen them. You can go into a booth and they kind of glow a little bit or whatever. But the dosaging is very, very high. The ability for that light to get into the body is restricted. It's not, the dosaging is not accurate. And when you talk about photobiomodulation therapy, there's a window of dosage. It has to be within a very specific window or else it doesn't help. So those infrared saunas are therapeutic, and they, in fact, may work on water molecules and changing the structure of them. I was reading about that. But when talking about photobiomodulation and the positive effects, you want to stick with lower wavelengths in the 800s or so typically, and red as well. So that's going to penetrate deeper, less absorbed by hemoglobin and blood and so forth, and get a little bit deeper. Will it make it to the uterus? Possibly, but it certainly will make it in and around that area. It all depends on sort of how much tissue there is in the way as well. So just to review, if you're new to what I'm talking about today, photobiomodulation therapy is the sort of scientific term for light therapy. And of course, you've seen it as red light therapy, or, you know, I'm going to go on about Juve again because they really annoy me. But anyway, light therapy, red light therapy, they try to, the terminology really is photobiomodulation therapy. And as I mentioned earlier, it uses very specific wavelengths of light and dosages. And these are absorbed by what's referred to as photoacceptors, a very specific areas in proteins or enzymes, and essentially it triggers a reaction inside the enzyme. The easiest way to describe this is this is what happens in a plant in photosynthesis, where chlorophyll absorbs radiation of the sun, right? And it converts the photonic energy of the sun into chemical energy so the plant can grow. I mean, that's it in a nutshell. We're not plants. It's a little bit different than that, but it's the same kind of concept. It's a photochemical reaction that occurs. And this photochemical reaction can actually help injured or inflamed tissues directly, if the light's absorbed directly into these cells or tissues that are undergoing problems, or indirectly or systemically that I mentioned earlier by immunomodulating circulating white blood cells. And we do a bit of both with our equipment, and that's what it's designed for. So light therapy or photobomb modulation, it will help reduce pain. Obviously, that's one of the keys, the problems with dysmenorrhea. Inflammation, again, this really has to do with prostaglandins. There is a paper, and there's quite a few papers. This is just one below. You can see here that was talking about the modulating PGE2. In this case, it was low back pain, and they measured prostaglandins in patients with low back pain using photobomb modulation therapy, and it was decreased. So it doesn't matter if it's low back pain or pain due to dysmenorrhea, prostaglandin E2 is going to cause symptoms. And if you can reduce the symptoms naturally, then it can be very, very helpful, as you can imagine. It can reduce edema and swelling and improve circulation as well through different mechanisms, especially through the release of nitric oxide, which causes temporary vasodilation. I'm going to present one paper here, but there's quite a few. And actually, it's quite interesting because they actually focus more on acupuncture points for using photobomb modulation therapy and helping with dysmenorrhea. But to be honest, the acupuncture points are exactly where the uterus is. So if you apply light therapy over that area, you're both stimulating the acupuncture point, but also more importantly, I feel, is you're getting light in and around the uterus area, which is going to help with the symptoms. So this one actually compared low-level light therapy using LEDs, so very similar to what is in our device, although they were more sort of focused on the acupuncture points, and looking at oral contraceptive treatment and looking to see which one was better, or were they equal, or did they help, right? So that's what they tried to do. So they tried to compare the two, and they also measured serum levels of nitric oxide, prostaglandin in patients. And these were with primary dysmenorrhea, by the way. So looked at 156 patients, obviously females, and they either received, the LED therapy, or they're randomized into the oral contraceptive pill group. And what they basically found was that there was a reduction of dysmenorrhea pain for both groups. So they actually found meaningful levels of pain reduction pretty much equal. I mean, I think there's slightly better relief with the oral contraceptive pill, but statistically they're about the same, which basically means, hey, if you can get the same effect without having to take oral contraceptives, then you would reduce the potential risk of stroke, of cervical cancer, perhaps, and some other side effects associated with long-term use of oral contraceptives. So to me, it sounds like maybe a win-win if it works for a specific individual. Okay, so let's talk a bit about using our equipment. We don't have a little protocol set up there for dysmenorrhea. It's kind of what we refer to as an off-label use, but at the end of the day, we can use this equipment for pain and inflammation associated with, different disorders. It just makes sense. But the protocol I'm going to reference is the hip. Tell you why is that, number one, the hip is sort of our longest timed protocol. And the reason for that is the hip's pretty deep, as is the uterus. So they coincide quite nicely. So I would recommend using the hip for treatment of dysmenorrhea. Very simply, for the most part, I'm going to say use 2 placements of the light pad. You're going to use it so that it covers the pubic region, and you can see sort of at the levels in that region to cover both the superior or top aspect of the uterus and the lower portion of the uterus as well. You might be able to cover it all in one placement, true. But if you sort of, overlap the area a little bit and provide a bit more systemic stimulation around that area, then I think you'll have an overall better effect. So these would be the two placements I'd recommend. And by the way, they're directly over those acupuncture points as well too. So you kind of cover that as well. Now, the other thing I'm going to suggest is treating the lower back. Now, let me back up a bit here. Oh yeah. So the reason I'm going to suggest that is, number one, almost inevitably, of course, I don't experience a dysmenorrhea, but I've been around a few that have, and including patients, obviously, and so forth. But the idea here is that low back pain is referred from the uterus. There's a highly sensitive nerve supplying the uterus, in part being derived from the sacral plexus in the lower back as well. So what I'd recommend is 2 placements over the lower back, essentially at the sort of the level of your hips, where they sort of, if you put your hands on top of your hip, you can feel your hip bone. Right across that area is the lumbosacral region. That's the lower lumbar spine and the beginning of the sacrum. 1 placement over that area, and then shift it a little bit lower down. You can feel 2 little dimples in your around your sacroiliac joint. Those are called the PSISs. And then around that area is your sacrum and the sacral plexus, and then do another placement there. This will stimulate both locally to help reduce low back pain, but also help to stimulate the innervation or part of the innervation of the uterus as well, which be helpful as well. So not mandatory, but if you're also, or whoever is using equipment experiences low back pain, then these would be the 2 placements I'd recommend. And again, you would use the low back protocol, not the hip protocol, for these 2. I think I showed that in the previous one. There you go. So you want to use the lower back protocol for obviously treating those 2 areas. And again, I encourage any questions. I see there might be a few. Just type them in as we go along, and I'll get to those, I guess, very shortly. So you're always going to start with level 1 intensity. This is a little bit lower dosaging, a little bit lower stimulation. For many people, that's very effective. And now, as far as how often you're going to be treating, the symptoms of dysmenorrhea typically last 12 to 72 hours in that range. So I'm going to say you could probably treat, in one day, say twice. Or in 6-hour increments, that kind of scenario. After you do a couple of sessions at level 1, if you're still finding things pretty uncomfortable, you can then click up to level 2. Now, you may just find certain levels work better for you, and that's perfectly fine. But I always like to start at baseline and see how you respond with that. So typically in that 12 to 72 hours, depending on how long your symptoms last, you may just apply it once, twice, or maybe a few times over that time frame to be helpful. So really, you're looking at light therapy, which may or may not have an immediate response. So just understand that. Sometimes you get an immediate response of relief, and sometimes it might take an hour or 2 or whatever to kick in, okay? So just be patient and understand that there may be a bit of a delayed response, because the cells are absorbing the light, and there's different physiological things going on for that to trickle down into actual analgesic or pain relief effect. Basically anti-inflammatory effect in part, but there's also an analgesic effect on nociceptors superficially as well. Remember, make sure you're treating primary dysmenorrhea. If there's any reason to be concerned that there's something else going on, get that checked out by obviously your family physician or a gynecologist or a healthcare professional that deals with that. Other treatments that when I was researching, obviously heat packs, whether it's a moist heat pack or a dry heat pack, may just give some relief, in part because heat is analgesic. There has been some research to suggest that some supplements, whether it's vitamin E, omega-3, vitamin B1, vitamin B6, even magnesium supplements, might reduce cramping. But again, it's worth a try, right? You do have to take that pretty consistently for a month or 2, I think, before you would notice a difference. So usually that's how that works. There was some research on yoga, and not so much yoga. I mean, you can do yoga, certainly you try and do it while you're experiencing the cramps, but a big part of the benefit is doing it in a routine well before, like, you know, on an ongoing basis, not just when you have the dysmenorrhea. And it may work in different ways, including relaxation, obviously, so like meditative kind of technique, but also engaging the pelvic core and the muscles as well. And there are different poses. I'm not a yoga aficionado, so I did put the link down there. The very specific moves. The very beginning one, I think, is more of a pelvic tilt, and that's kind of, I guess it's a yoga, but it's a normal pelvic exercise as well. And there are some other exercises that may be helpful as well. So I encourage you to look at those options as well. A little bit of research on natural teas. They may be calming, relaxing. I don't know if they're going to be overly helpful or not, but you can certainly give it a try. Ginger, fennel, cramp bark. I don't even know what that is, but I can give that a shot. I know chamomile and peppermint are ones that are recommended for just calming or soothing as well. Okay, thank you so much. So I guess we're finished pretty much on time. I do want to mention we have a couple of upcoming webinars. Next one is for chiropractors or folks, you know, in maybe chiropractic offices that may be looking at incorporating laser therapy into their practice. So that one's coming up in November. And then I have my year-end review of the research in December. I'll bring in Dr. Randy Santiago, our clinical research director here at BIOFLEX, and we'll go over some really fascinating research that was published in 2022. Lots of different cool papers that I think you'll find interesting. I'm not going to go into real specific details, but if you go to our link on our website, and you can see some of the topics that we'll discuss for that as well. So again, if you want to reach out to me, there's my email, david@bioflexlaser.com. I'm just going to get to some of the questions here. So a question about endometriosis. I mean, yeah, I've seen it helpful for endometriosis as well, too. But what I don't want to, say, first of all, it's a direct treatment for endometriosis. It may be helpful. But I would say, obviously, first, make sure you're dealing with that. Make sure you're understanding what your all your options are. But this is a treatment that has no side effects, and it's certainly worth trying as well. So that was a question we had as there. So a question here, a comment from Betsy, RMT in Halifax. A comment about iliopsoas is very involved with respect to dysmenorrhea. Do that. I also find that doing groin, anterior hip locations really helpful too, especially as iliacus trigger points, given the cross with low back pain, and psoas trigger points. Yeah, so I mentioned treating the lower back, but absolutely, I completely agree. The iliopsoas, or these are hip flexor muscles, are in your groin. So literally, if you put your hand out in front of your groin and shift it out a little bit towards your hip bone and deep in there, sort of at the crease of your hip area, that's the area that Betsy was referring to. You can use a hip placement over that as well, which may sort of relax that area. So that's a great point as well. I do appreciate that. Thanks for letting me know. A question here, is it safe to use with respect to endometriosis? Would it facilitate overgrowth, cyst, that kind of thing? No, so it's not a contraindication to treat over endometriosis. There's not a lot of research on this topic, I must say, but with respect to the symptoms and pelvic inflammatory diseases, that kind of thing, it should be helpful for that as well too. This webinar isn't sort of geared towards that, but we're actually just finishing up a clinical trial on vulvodynia, painful intercourse, and the report will be published. The clinical trial will be published next year. Finding positive results. So, and we're going to do a much larger trial. So, and part of that, we're actually going to do one for dysmenorrhea as well, and maybe some other associated problems like endometriosis. Okay, so let me just see if there are any other questions out here for me. Is there a maximum time the pad should be applied? So the time is specific to the protocol. So the HIP protocol, I think, is 18 minutes per sort of session, a little bit longer than the other areas. So that's already predetermined, Evelyn. So sometimes, so these are preset, so you can't overdo it. It's designed for a specific dosage, and I get that. People want to go more the better. It doesn't work that way. It has to be a specific dosage, and that's why they're preset for that as well too. Okay, question about long COVID. Someone was mentioning that as well too, and such. If you're interested in that, shoot me an email. Cassie, I know you put your email there, but I won't have access to it after I get out of this. So, or maybe I will, but I'm not sure. But if you can just email me, David@BIOFLEX, and I'll get that research out to you. Hi, Dr. Chantal, who I know very well out in Quebec. Actually, I'm going to be out in Quebec City in a few weekends for a little vacation out there. I really enjoy Quebec City. So anyway, she's looking at the clinical user manual. So there's not a specific protocol for primary dysmenorrhea, Chantal. On the professional side, you can email me and I can suggest that. But essentially, it's going to be pretty similar to what I'm suggesting here already, which is using the HIP protocol or around that. But we can have a discussion about that via email as well, too. I don't mind responding to you as well. Question here from Zara. I'm an internist using photobiomodulation in my office. I want to know how many joules do you irradiate and how many sessions? So with respect to joules of energy, Zara, so I'm going to just mention a couple of things here. There's different ways of referencing energy and the dosaging. It's kind of now accepted that it's going to be joules per centimeter squared, which takes into consideration the surface area that you're applying the energy to, as opposed to the total energy in one specific spot. Our devices for the red, they vary in total milliwatts. I think it's around 750 to 1,000 milliwatts. I'd have to double check that for red, and about 1,500 milliwatts for the infrared. But again, to be honest, I'm just gapping on that. Then you have to, so that's power. Then you have to multiply it by the time, which will give you the joules, right? But then you have to really should be dividing that by the surface area of the pad, which will give you the dosaging for that. Now, for photobiomodulation, there's recommendations for using a laser and getting dosage. We're not using a laser for this specific one. We're actually using LEDs over much larger surface area. So it's a little bit different with respect to the dosaging, because we're not applying lots of energy to a small area. So long story short, if you want to know the exact amount of joules, of course, that's determined by the amount of treatment time. And I can get that number to you, Zara, if you'd like that, by just emailing me. I don't mind doing that, but I prefer talking joules per centimeter squared as well. A question from Dr. Tooten. I hope I'm saying that right. Sorry. Age restriction. Well, I have to say that that when you look at FDA approval, Health Canada approval, it's approved for adults, but there is research on children and adolescents, and it's not contraindicated over growing epiphyseal plates, that kind of thing, and it's safe and there's no side effects. So I would say that and we've treated many adolescents and even children with light therapy. There's really no reason not to, but just understand that the approval is for adults. But again, we're talking about light therapy, and there's very few contraindications. Contraindications are over growing fetus, over cancer, over actively bleeding tissues, those kinds of things. So our website is bioflexlaser.com. That's our website. Question here, by doing it, does it affect future months of dysmenorrhea? In other words, when you treat, will it reduce the symptoms sort of down the line? That's a great question. I don't think I've seen research on that. And to be honest, I don't have enough experience to really know that kind of scenario. I think there's lots at play there. I don't know if it would or not. I'd be surprised if it did. Because you're only using it in a short time frame. And also too, there's so many aspects as to why it's severe or not severe, so that I'm not sure if it would or not. Is the control unit the same for the two different sizes of pads, or are they programmed differently? No, in fact, the control unit, I believe, is the same. Now that I'm trying to remember now, I believe they are the same. I don't know if they're interchangeable or not. I think they are. Kathy, you can email me and I can find that. I should know that, but that escapes me right now. Okay, that's it. Thanks, everyone. I do appreciate your time today. And again, you can email me. Oh, by the way, we might be having a sale coming up on these devices. I don't know if I'm supposed to say this or not, a Black Friday sale. So stay tuned. If you've gotten an email for this webinar, you should get an email about that sale coming up for American Thanksgiving. I don't know when it is. Don't ask me. I know when American Thanksgiving is, but I don't know when that exact sale is, but it's coming up soon. Okay, I think that's it. Oh, a question about, does it increase the bleeding? So here's the thing. The light isn't directly going into the uterus, to be honest. So it's not going to have a direct response on increasing the direct circulation or the bleeding in that area. So I don't think it's going to have that effect because the uterus lies so deep. The effect really is mediated probably more systemically or indirectly. But I haven't seen research on that. So, and I haven't had any feedback on that either. So it shouldn't, as far as I know. Sorry, just looking to see here. So yeah, Dr. Tootin, about potentially could it benefit future pain episodes with application between menses. In general, I think it may be very helpful for that because it seems to help in this systemic way. Great connecting with you, doctor, and I can share lots of really cool and interesting research for you. And we're actively doing research, in different areas. So that may in fact be the case as well too. All right, wonderful. Thanks again, everyone, and have a great afternoon.